When we talk about sexual health, it often feels like the conversation defaults straight to what not to do.
Right. All the dangers.
Exactly. The risks, the diseases, the things to avoid. But what if focusing so much on the caution side means we're missing something really key?
Something fundamental.
Yeah, fundamental to human sexuality itself.
Welcome to the Sex Science Podcast, where we turn the latest peer-reviewed research on intimacy and sexuality into fun, accessible conversations. Generated by AI and fact-checked by experts, the Sex Science Podcast was created by LaShaw to empower you through knowledge. So, join us as we explore pleasure, relationships, human connection, and everything in between.
Today we're doing a deep dive into this really fascinating research article. It's by Zaneva and colleagues, and it asks such a powerful question. What is the actual added value of bringing pleasure into sexual health interventions?
It's a huge question.
We're going to unpack why this seemingly obvious piece has been, so overlooked, and what the research says happens when we finally start talking about it.
It's pretty critical, for decades, even with billions spent globally on SRHR, sexual and reproductive health and rights.
Billions, yeah.
Sexual pleasure just hasn't really been part of the picture. It's been understudied, often just dismissed in most programs.
Like it's separate from health somehow.
Exactly. It's almost like we got so focused on the health and rights bits that we kind of forgot the main reason people often engage sexually in the first place.
I'm still trying to wrap my head around that paradox, though. Why? Why do you think pleasure got sidelined so hard for so long? Because it feels so fundamental. And it's not like the connection is totally ignored. I mean, people often say concerns about less pleasure or lower libido are reasons they don't use condoms or stop using contraception. So the impact of pleasure or not having it is already kind of acknowledged, just usually negatively. What are we missing?
That's a great question, and it really gets to the core of it. For a very long time, the standard approach to sexual health has basically been this ill health prevention model. What that means is interventions mostly focused on the dangers, the risks of unprotected sex, HIV, STIs. And there was this underlying assumption, I think, that people make sexual decisions based purely on rational health facts. Like, if you just tell them the risks, they'll automatically make the quote-unquote right choice. It's almost like acknowledging pleasure was seen as, condoning risky behavior instead of seeing it as a positive motivator. And the study, the Zaneva one, it really challenges that. It brings that human element, pleasure, back into the equation, moving beyond just avoiding bad outcomes.
Okay, so we've got this gap, this missed opportunity. The big question then is, who actually tested this? Who looked at it and said, hang on, what if pleasure isn't the problem, but maybe part of the solution? And that's where Zaneva et al. Come in with this really solid study. It's a systematic review and meta-analysis 2022. And its significance, it's huge because it's the first one to look at interventions that included pleasure beyond just making condoms look nicer. That older idea, condom eroticization, was often quite narrow. This new work looks much deeper at the actual experience of pleasure.
That's right. And they followed PRISMA guidelines, which for anyone listening, that's basically the gold standard for doing these kinds of reviews properly, very transparent, very comprehensive. In this case, Zaneva and her team, they dug through 7 major databases, looking for articles published between 2005 and 2020. That's 15 years of research. And this careful process found 33 unique interventions. We're talking nearly 19,000 participants involved at the start. And crucially, they used a really broad definition of sexual pleasure, thinking of it as the physical and/or psychological satisfaction and enjoyment derived from shared or solitary erotic experiences, including thoughts, fantasies, dreams, emotions, and feelings. So a really holistic view, not just one thing, and that's key. So what did all this careful research actually find? Did it solve our paradox? Okay, get this, because the numbers really tell a story here. The core quantitative finding, this is from the meta-analysis of 8 specific studies. It's clear. Putting sexual pleasure into SRHR interventions led to a moderate, positive, and significant effect on condom use. They measured it with something called Cohen's d, which came out at 0.37. Now, that might sound technical, but what it means practically is a real noticeable improvement. People in the pleasure-inclusive groups used condoms more often than those in the standard groups. It's not just a guess, it's statistically measurable, a real step up.
And connecting that dot, more condom use directly means potential reductions in HIV and STIs. That's a huge public health win right there.
What's even more compelling, maybe, is that this positive effect was found above and beyond standard care. So these pleasure-focused interventions weren't just, as good as what we were already doing. They were actually better. It clearly shows added value. It suggests we've been missing a pretty important ingredient all along.
Wow, okay. The data is strong, a clear win on the numbers. But what did these interventions actually look like on the ground? How did they manage to get these results, and where were they doing this? Because you mentioned qualitative findings too, right? Showing positive effects on knowledge and attitudes. And it wasn't just in one place, you said 25 in the U.S., but also South Africa, Brazil, Spain, UK, Singapore, Nigeria, Mexico. Quite a spread.
Exactly. The narrative synthesis part of the review gives us some really good examples of how pleasure was brought in, and it varied depending on the group. So, for instance, with men who have sex with men, some interventions talked about practical skills, how condom use could actually be fun and pleasurable. They might emphasize things like using lube, framing safer sex, not as a drag, but as an enhancement. There was even one called Focus on Future that directly aimed to promote condom use specifically to enhance sexual pleasure. A total reframe.
Right, so practical skills for one group. What about others? It sounds like tailoring the approach was key.
Absolutely. Tailoring seems crucial. For people who use or have used drugs, pleasure was often integrated by negotiating harm reduction strategies together. And, interestingly, by eroticizing safer sex practices, making them appealing, not just necessary. Some of these programs took a really empowering, rights-based approach. Participants looked at their own sexual rights, positive choices, affirming their right to pleasure, and get this, one interactive, pleasure-inclusive intervention specifically showed a 50% decrease in HIV STI incidence compared to a standard lecture-style control group.
50%? That's massive.
That's a huge difference. Really shows the potential impact. And then for young people, say, in schools, there were large programs in Spain and Brazil that presented sexuality positively as a source of pleasure. They use interactive, empowering activities, not just fear tactics, and both led to increased condom use.
So the common thread, it seems, across all these different groups and places was moving beyond just, don't do this, it's risky. They actually integrated the positive side of sex into the conversation, making safer choices appealing not just out of fear, but because they could actually improve people's experience of their pleasure. It's a really smart shift.
Definitely. But, connecting this to the bigger picture, the study wasn't shy about pointing out some important limitations, too. Gaps we need to address. One major one was the intervention focus. Every single included study targeted HIV or STI risk reduction. Critically, none of them took place in the context of pregnancy prevention or family planning programs. That's a huge area central to SRHR, completely missing from this evidence base on pleasure, a glaring gap.
That really is a big blind spot. Why do you think that is? Especially since family planning is such a core part of SRHR. Was it just how funding works, or maybe a discomfort with linking pleasure to pregnancy prevention specifically?
It's likely a mix of things. Historically, family planning often focused heavily on fertility control, demographic targets, preventing maternal deaths, which are vital, of course, but maybe less focused on the holistic sexual experience. Adding pleasure might have seemed off topic, or potentially controversial in certain settings, pulling focus from the main goal of preventing pregnancy. So yeah, historical priorities, funding streams, maybe some lingering awkwardness about talking pleasure and babies in the same breath. Another key limitation was the population focus. Most interventions targeted groups often labeled high risk, like MSM, people using drugs, which means there's a big evidence gap for what you might call the general population. Heterosexual individuals, women of reproductive age generally, older women. These groups are studied a lot in other SRHR areas, but not so much in these pleasure-inclusive studies.
Okay, so the path forward seems pretty clear then. We need research that fills these gaps, looking at pleasure and family planning, looking at broader populations, and maybe using other measures too, not just self-reports, like biological markers for STIs perhaps. Plus, researchers really need to describe the pleasure part of their interventions clearly so future reviews can analyze them properly. It's about building better evidence.
Exactly.
So, for you listening right now, here's something to think about. Based on everything we've just discussed, what if the best way forward for public sexual health isn't just doubling down on fear and risk? What if it's about truly embracing and integrating that fundamental human desire for pleasure into how we design and deliver health programs?
Yeah, it's a pretty fundamental perspective shift, isn't it? Moving away from the deficit model, what's wrong, what's dangerous, towards one that acknowledges and even leverages fulfillment and enjoyment. Imagine how that kind of thinking could potentially reshape public health, not just in SRHR, but maybe across other areas of well-being too, offering a more holistic, maybe more effective, and potentially even a more, dare I say, joyful path forward for everyone.
Thank you for listening to the Sex Science Podcast, brought to you by LaShaw. We hope that you learned something new about the wonderful world of human intimacy and sexuality, and join us next time as we dive into more fascinating research. And remember, science is for you. Music for this podcast was produced by SoundRaw.